Calamox 1.2 grams injection is a combination antibiotic medication containing amoxicillin and clavulanic acid. This formulation is used to treat a variety of bacterial infections, particularly those caused by beta-lactamase-producing organisms resistant to standard penicillins. The combination of amoxicillin, a broad-spectrum penicillin, and clavulanic acid, a beta-lactamase inhibitor, extends the antibiotic's efficacy against resistant bacteria. BoschPharma.com. Composition and mechanism of action. Calamox 1.2 grams injection comprises 1 gram of amoxicillin and 200 milligrams of clavulanic acid. Amoxicillin works by inhibiting the synthesis of bacterial cell walls, leading to cell lysis and death. However, some bacteria produce beta-lactamase enzymes that can inactivate amoxicillin. Clavulanic acid inhibits these enzymes, thereby protecting amoxicillin from degradation and broadening its spectrum of activity. BoschPharma.com. Indications. Calamox 1.2 grams injection is indicated for the treatment of various severe bacterial infections, including respiratory tract infections, for example, pneumonia, skin and soft tissue infections, urinary tract infections, bone and joint infections, intra-abdominal infections, gynecological infections, sepsis. It is also used prophylactically in surgical procedures to prevent potential infections. BoschPharma.com. Dosage and administration. The dosage of Calamox 1.2 grams injection depends on the severity of the infection and patient factors such as age, weight, and renal function. For adults, the typical dose is 1.2 grams administered every 8 hours. In cases of severe infections, the frequency may be increased. For children, dosing is based on body weight, with specific guidelines provided for different age groups. The injection is administered intravenously, either as a slow injection over 3 minutes or as an infusion over 30 minutes. BoschPharma.com. Contraindications. Calamox 1.2 grams injection is contraindicated in patients with a history of serious hypersensitivity reactions, for example, anaphylaxis to amoxicillin, clavulanic acid, or other beta-lactam antibiotics, previous liver dysfunction associated with the use of amoxicillin, clavulanic acid. It should be used with caution in patients with hepatic impairment or severe renal impairment. MedicalGuidelines.msf.org. Adverse effects. Common side effects may include nausea, vomiting, diarrhea, rash. Serious adverse effects, though rare, can occur. Severe allergic reactions, for example, anaphylaxis, hepatic dysfunction, Clostridium difficile associated diarrhea, seizures, particularly in patients with renal impairment or receiving high doses. Patients should be monitored for these adverse effects, and appropriate measures should be taken if they occur. MedicalGuidelines.msf.org. Pharmacokinetics. After intravenous administration, both amoxicillin and clavulanic acid distribute widely in body tissues and fluids. Amoxicillin is primarily excreted unchanged in the urine, while clavulanic acid undergoes metabolism and is eliminated via renal and non-renal pathways. The elimination half-life of both components is approximately 1 hour in individuals with normal renal function. BoschPharma.com. Special populations. Renal impairment. Dosage adjustments are necessary for patients with significant renal impairment to prevent accumulation and potential toxicity. Hepatic impairment, caution is advised, and liver function should be monitored during treatment. Pediatrics. Dosing should be carefully calculated based on the child's weight and age. Elderly. No specific dosage adjustments are necessary solely based on age. However, renal function should be considered. Drug interactions. Calamox 1.2 grams injection may interact with allopurinol, increased risk of allergic skin reactions. Anticoagulants. Enhanced anticoagulant effect monitoring is recommended. Methotrexate, increased toxicity due to reduced renal clearance. Storage and handling. Calamox 1.2 grams injection should be stored in a cool, dry place, away from direct light. Reconstituted solutions should be used immediately or stored under recommended conditions to maintain potency. BoschPharma.com. Conclusion: Calamox 1.2 grams injection is a valuable antibiotic option for treating various severe bacterial infections, especially those caused by beta-lactamase-producing organisms. Its combination of amoxicillin and clavulanic acid extends its efficacy against resistant bacteria. Proper patient selection, dosing, and monitoring are essential to maximize therapeutic outcomes and minimize potential adverse effects.